Hey y'all, I just wanted to do a quick little video about feline diabetes for anybody who is considering adopting our sweet little diabetic guys. This is Skooma. He's probably the sweetest cat you'll ever meet, and in fact he's so sweet he has diabetes. Diabetes is pretty easy to manage in cats, so you see now he's wearing a shirt. It's not just because he is fashionable, but we actually have a Libre installed on him which measures his glucose. You can install it yourself. You can get the vet to install it. We don't always have to put it on him, but sometimes we like to check how well his insulin levels are being managed. And the best way to do that is by monitoring his glucose. And it's a lot less intrusive than poking him before he eats or doing a glucose curve. So you get more information on that. As far as food, we don't do anything super special. Diabetic cats do best on a low carb food, which means that wet food is always the best. And in fact, this pate wet food, and as you can see, it's not the expensive vet brand. And some cats can be managed just through giving them pate food, and they can actually go into remission. So diet's super important. There are 2 known dry foods that so far that are no carb, and we use Dr. Elsie's Pure Protein for snackies sometimes. And then we always have gravy in case he dips a little too low. We can just feed him gravy food and it'll spike his blood sugar back up. But we only really use this stuff for emergency cases. There's a lot of different insulins on the market, and if a cat is not responding well to one, they can always try another. This is a human Lantus pen. You can use this, I think we get 3 months out of it. They say to change it every 30 days. However, a lot of us in the diabetic groups have not seen a difference changing it, and vets are now saying that you can use it for longer. It's just the FDA has only tested for 30 days and not longer. So this is Prozinc, which is just a cat, an animal insulin. And the thing to be aware of is if you change insulins, you have to make sure, like this is a U40 insulin, so you have to use a U40 insulin syringe. And this is a U100. You can kind of see down in there. So you have to use a U100 insulin syringe. It's not too hard. You just feed them twice a day. And while they are busy getting their food, you can tent up the back of their skin. So here I'm showing you preparing George's Lantus for the evening. It's the same as in the morning. We pull up the 1 unit or however much we have to give them for that day. You notice me popping up the nape of the neck. She doesn't notice it that bad. Cats are pretty heavy duty in that area. And you can see she's still eating. No muss, no fuss.